Hey, what up? Welcome to your medical terminology lecture for Chapter 12, the integumentary system, the skin. So let's get to it. So we have 5 different major structures. We're going to cover their related word parts and also their primary functions. First up is the skin with the word parts cutaneo, dermato, and dermo. Intact skin is the first line of defense for the immune system. Skin also waterproofs the body and is the major receptor for the sense of touch. Sebaceous glands, with the word root sebo, secrete sebum, oil, to lubricate the skin and discourage the growth of bacteria on the skin. Sweat glands, with the word root hydro, secrete sweat to regulate body temperature and water content and excrete some metabolic waste. Hair, with the word roots pili and pillow, aids in controlling the loss of body heat. Nails, onkyo and unguo, protect the dorsal surface of the last bone on each finger and toe. The integumentary system, which makes up the outer covering of the body, serves many important functions beyond appearance. The skin waterproofs the body and prevents fluid loss. Intact, skin plays important roles in the immune system. Skin is the major receptor for the sense of touch. And skin helps the body synthesize vitamin D from the sun's ultraviolet light while screening out harmful ultraviolet radiation. Sebaceous glands, also known as oil glands, secrete sebum, oil, which lubricates the skin and discourages the growth of bacteria on the skin. Sweat glands help regulate body temperature and water content by secreting sweat. Also, a small amount of metabolic waste is secreted through the sweat glands. Hair helps control the loss of body heat, and nails protect the dorsal surface of the last bone of each toe and finger. The integumentary system consists of the skin and its related structures: sebaceous glands, sweat glands, hair, and nails. Skin covers the external surfaces of the body. The terms derma and cutaneous are both used to describe the skin. The skin is a complex system of specialized tissues and made up of 3 strata of tissue: epidermis, dermis, and subcutaneous layers. Epithelial tissues form a protective covering for all of the internal and external surfaces of the body. The epidermis, which is the outermost layer of the skin, is made up of several specialized epithelial tissues. Squamous epithelial tissue, which forms the upper layer, consists of flat, scaly cells that are continuously sloughed off. Squamous means scale-like. The epidermis does not contain any blood vessels or connective tissue and is dependent on lower layers for nourishment. Cells are produced in the lower basal layer and pushed upward. When these cells reach the surface, they die and become filled with keratin. Keratin is a fibrous water-repellent protein. Soft keratin is a primary component of the epidermis. Hard keratin is found in the hair and nails. The basal cell layer also contains special cells called melanocytes. These cells produce and contain a dark brown to black pigment called melanin. The type and amount of melanin pigment determine the color of the skin. Melanin also protects the skin against some of the harmful ultraviolet rays of the sun. Ultraviolet refers to light that is beyond the visible spectrum at the violet end. Some UV rays help the skin produce vitamin D, but others can cause damage. The dermis, also known as the corium, is the thick layer of living tissue directly below the epidermis. It contains connective tissue, blood, and lymph vessels, nerve fibers, plus hair follicles and sebaceous and sweat glands. Sensitive nerve endings in the dermis receive impulses that enable the body to recognize sensory stimuli such as touch, temperature, pain, and pressure. Tactile means pertaining to touch. Perception is the ability to recognize sensory stimulus. Collagen, which means glue, is a tough yet flexible fibrous protein material. In addition to being found in the skin, collagen is also found in bone, cartilage, tendons, and ligaments. Some cosmetics contain artificially produced collagen protein, which is claimed to minimize wrinkles. Mast cells, which are found in the connective tissue of the dermis, respond to injury or infection by producing and releasing substances including heparin and histamine. Heparin, which is released in response to injury, is an anticoagulant. Histamine, which is released in response to allergens, causes itching and increased mucus secretion. The subcutaneous layer located just below the skin connects the skin to the surface muscles. This layer is made up of loose connective tissue and fatty adipose tissue. Adipose means fat. Cellulite is a non-technical term for the subcutaneous deposit of fat, especially in the thighs and buttocks. Lipocytes, also known as fat cells, are predominant in the subcutaneous layer, where they manufacture and store large quantities of fat. The structures associated with the integumentary system are the sebaceous glands, sweat glands, hair, and nails. Sebaceous glands are located in the dermis layer of the skin and are closely associated with hair follicles. These glands secrete sebum, which is released through ducts opening into the hair follicles. From here, the sebum moves onto the surface and lubricates the skin. Because sebum is slightly acidic, it also discourages the growth of bacteria on the skin. The milk-producing mammary glands, which are modified sebaceous glands, are often classified with the integumentary system. However, we'll discuss them later in the reproductive system. Sweat glands are tiny coiled glands found on almost all body surfaces. They are most numerous in the palms of the hands, the soles of the feet, the forehead, and the armpits. Ducts from sweat glands open on the surface of the skin through pores. Sweat, also known as perspiration, is secreted by sweat glands and is made up of 99% water plus some salt and metabolic waste products. Perspiring or secreting sweat is a means of excreting excess water. It also cools the body as the sweat evaporates into the air. Body odor associated with sweat comes from the interaction of the perspiration with bacteria on the skin surface. Hydrosis means the production and excretion of sweat. Hair fibers are rod-like structures composed of tightly fused, dead protein cells filled with hard keratin. The darkness of the hair is determined by the amount of melanin produced by the melanocytes that surround the core of the hair shaft. Hair follicles are the sacs that hold the root of the hair fibers. The erector pili, also known as erector muscles, are tiny muscle fibers attached to the hair follicles that cause the hair to stand erect. In response to cold or fright, these muscles contract, cause raised areas of the skin known as goosebumps. This action reduces heat loss through the skin. A nail, also known as an unguis, is the keratin plate covering the dorsal surface of the last bone of each toe and finger. Each nail consists of these parts. The nail body, which is translucent, is closely molded to the surface of the underlying tissues. It is made up of hard, keratinized plates of epidermal cells. The nail bed, which joins the nail body to the underlying connective tissue, nourishes the nail. The blood vessels here give the nail its characteristic pink color. The free edge, which is the portion of the nail not attached to the nail bed, extends beyond the tip of the finger or toe. The cuticle is the narrow band of epidermis attached to the surface of the nail just in front of the root. Cuticle means little skin. The lunula is a pale half-moon-shaped region at the nail root and is generally found in the thumbnail and in varying degrees in other nails. Lunula means little moon. The root fastens the nail to the finger or toe by fitting into a groove in the skin. Now for some medical specialties related to the integumentary system, such as a dermatologist who specializes in diagnosing and treating disorders of the skin, or a cosmetic surgeon, also known as a plastic surgeon, who specializes in the surgical restoration and reconstruction of body structures. Plastic in this title refers to plasti, the suffix meaning surgical repair. Ooh, what's that? Now let's look at the horrible things that can go wrong in the pathology of the integumentary system. Acne vulgaris is a chronic inflammatory disease that is characterized by pustular eruptions of the skin in or near the sebaceous glands. Although common during puberty and adolescence, it also occurs in adults. A comedo is a lesion formed by the buildup of sebum and keratin in a hair follicle. Comedones are associated with acne vulgaris. When the sebum plug is exposed to air, it oxidizes and becomes a blackhead. A sebaceous cyst is a cyst of a sebaceous gland that contains yellow fatty material. A cyst is a closed sac or pouch containing fluid or semi-solid material. Seborrhea is any of several common skin conditions in which there is an overproduction of sebum. Seborrheic dermatitis is an inflammation of the upper layers of skin caused by seborrhea. This results in the scaling of the scalp, known as dandruff. Mild dandruff may be caused only by overactive oil glands. In newborns, this condition results in a scalp rash known as cradle cap. A seborrheic keratosis is a benign flesh-colored brown or black skin tumor. These growths tend to occur most often in the elderly. Anhidrosis is the condition of lacking or being without sweat. Hyperhidrosis is a condition of excessive sweating. Diaphoresis means profuse, but not necessarily excessive, sweating. Miliaria, also known as heat rash and prickly heat, is an inflammation caused by trapped sweat. This produces a skin rash and itching. Please don't confuse this with malaria, an infectious disease. Hirsutism means abnormal hairiness. This term usually refers to the appearance of male body or facial hair patterns in the female. Alopecia, also known as baldness, is the partial or complete loss of hair. Alopecia areata is an autoimmune disorder in which there are well-defined bald areas, usually on the scalp and face. Alopecia capitis totalis is an uncommon condition characterized by the loss of all of the hair on the scalp. Alopecia universalis is the total loss of hair on all parts of the body. Female pattern baldness is a condition in which the hair thins in the front and on the sides, and sometimes on the crown. It rarely leads to total hair loss. Male pattern baldness is a common hair loss pattern in men, with the hairline receding from the front to the back until only a horseshoe-shaped area of hair remains in the back and on the temples. Clubbing is abnormal curving of the nails that is often accompanied by enlargement of the fingertips. This condition can be hereditary or can be caused by changes associated with oxygen deficiencies related to coronary or pulmonary disease, which usually occurs in adults. Koilonychia, also known as spoon nail, is a malformation of the nails in which the outer surface is concave or scooped out. Koilonychia is often indicative of iron deficiency anemia. Onychia, also known as onychitis, is an inflammation of the matrix of the nail. Onychocryptosis means ingrown toenail. Onychomycosis is any fungal infection of the nail. This condition, which is difficult to treat, may cause the nails to turn yellow, brown, or black, and become thick or brittle, depending on what type of fungus is involved. Onychophagia means nail biting or nail eating. Paronychia is an acute or chronic infection of the skin fold at the margin of the nail. A subungual hematoma, which is usually caused by an injury, is a collection of blood trapped in the tissues under a nail. Eventually, the body reabsorbs this blood. Albinism is an inherited deficiency or absence of pigment in the skin, hair, and eyes due to an abnormality in production of melanin. Chlasma, also known as melasma or the mask of pregnancy, is a pigmentation disorder characterized by brownish spots on the face. This may occur during pregnancy and usually disappears after delivery. Dyschromia is any disorder of the pigmentation of the skin or hair. Melanosis is any condition of unusual deposits of black pigment in different parts of the body. Vitiligo is a condition in which a loss of melanocytes results in whitish areas of skin bordered by normally pigmented areas. The unpigmented skin is extremely sensitive to sunburn. A lesion is a pathologic change of the tissues due to disease or injury. Lesions are described by their appearance, location, color, and size as measured in centimeters. A contusion is an injury that does not break the skin and is characterized by swelling, discoloration, and pain. A crust is a collection of dried serum and cellular debris. An ecchymosis, also known as a bruise, is a purplish area caused by hemorrhaging within the skin. A macule is a discolored flat spot that is less than 1 centimeter in diameter, Freckles or flat moles are macules. Nevi, also known as moles, are small dark skin growths that develop from melanocytes in the skin. Normally, these growths are benign. However, dysplastic nevi are atypical moles that may develop into skin cancer. A nodule is a small, solid bump. It may be felt within the skin, or it may be raised as if it had formed below the surface of the skin and pushed upward. A cyst is a nodule. A papule is a small, solid, raised skin lesion that is less than half a centimeter in diameter. Warts, insect bites, and skin tags are types of papules. Petechiae, which are small pinpoint hemorrhages, are smaller versions of ecchymoses. A plaque is a solid raised area of skin that is different from the area around it, and greater than half a centimeter in diameter. The lesions of psoriasis are plaques. A scale is a flaking or dry patch made up of excess dead epidermal cells. Some shedding of scales is normal. Excessive shedding of scales is associated with skin disorders, such as psoriasis. Verrucae, also known as warts, are skin lesions caused by the human papillomavirus. Plantar warts develop on the sole of the foot. A wheal is a smooth, slightly elevated, swollen area that is redder or paler than the surrounding skin and usually is accompanied by itching, for example, an insect bite or hives. An abscess is a localized collection of purulent exudate within a circumscribed area. Purulent means producing or containing pus. Circumscribed means containing within a limited area. A bulla is a large circumscribed elevation of skin containing fluid that is more than half a centimeter in diameter. A large blister is a bulla. A cyst is a closed sac or pouch containing fluid or semi-solid material. The most common type of cyst is one filled with sebaceous secretions. A pustule is a small, circumscribed elevation of the skin containing pus. Pus-containing pimples, such as those associated with acne, are pustules. A vesicle is a circumscribed elevation of skin containing fluid that is less than half a centimeter in diameter. A small blister is a vesicle. An abrasion is an injury in which superficial layers of skin are scraped or rubbed away. The term abrasion also describes treatment involving scraping or rubbing away skin. A fissure of the skin is a groove or crack-like sore. The term fissure also describes normal folds in the contours of the brain. A laceration is a torn or jagged wound or an accidental cut. A puncture wound is a deep hole made by a sharp object, such as a nail. The risk for infection, especially tetanus, is greater with this type of wound. An ulcer is an open sore or erosion of the skin or mucous membrane resulting in tissue loss and usually with inflammation. Take note that ulcers also occur inside the body. A decubitus ulcer, also known as a pressure ulcer or bedsore, is an ulcerated area caused by prolonged pressure that cuts off circulation to a body part. Decubitus means lying down. A port wine stain is a large reddish-purple discoloration of the face or neck. This discoloration will not resolve without treatment. A strawberry hemangioma is a soft, raised birthmark. This dark reddish-purple growth is a benign tumor made up of newly formed blood vessels. These usually resolve without treatment by about age 7 years. Dermatitis is an inflammation of the upper layers of skin. Contact dermatitis is a localized allergic response caused by contact with an irritant or allergen. Symptoms include erythroderma, itching, and rash. Dermatosis is a general term used to denote any skin lesion or group of lesions or eruptions of any type that are not associated with inflammation. Eczema is an acute or chronic skin inflammation characterized by erythema, papules, vesicles, pustules, scales, crusts, scabs, and possibly itching. These symptoms may occur alone or in combination. Erythema is any redness of the skin, such as a nervous blush, inflammation, or mild sunburn. Lupus erythematosus, LE, also known as systemic lupus erythematosus, SLE, is an autoimmune disorder that is characterized by red, scaly rash on the face and upper trunk. In addition to the skin, lupus erythematosus also involves other body systems. Lipidemia is an abnormal swelling due to the collection of fat and fluid under the skin, usually between the calf and ankle. Pruritus, also known as itching, is associated with most forms of dermatitis. Psoriasis is a chronic autoimmune disorder of the skin characterized by red papules covered with silvery scales that occur predominantly on the elbows, knees, scalp, back, and buttocks. Purpura is a condition characterized by hemorrhage into the skin that causes spontaneous bruising. Rosacea is a chronic condition of unknown cause that produces redness, tiny pimples, and broken blood vessels. It usually occurs on the central area of the face and appears most often in people with fair complexion. Scleroderma is an autoimmune disorder that causes abnormal tissue thickening, usually starting on the hands, feet, or face. Some forms of the disease spread to other body systems and can be fatal. Urticaria, also known as hives, is a skin condition characterized by localized areas of swelling accompanied by itching that is associated with an allergic reaction. Xeroderma is excessively dry skin. A carbuncle is a cluster of furuncles, boils, that result in extensive sloughing of the skin and scar formation. Cellulitis is a diffuse infection of connective tissue with severe inflammation within the layers of the skin. Diffuse means widespread. Furuncles, also known as boils, are large, tender, swollen areas caused by staphylococcal infection around hair follicles. Gangrene is tissue necrosis that usually is associated with a loss of circulation. The tissue death is followed by bacterial invasion that causes putrefaction. Putrefaction is decay that produces foul-smelling odors. Impetigo is a highly contagious bacterial skin infection characterized by isolated pustules that become crusted and ruptured. Anthrax, which is caused by the bacterium Bacillus anthracis, is a contagious disease of warm-blooded animals, including humans. In humans, it takes the form of cutaneous anthrax, which causes black sores in the skin, or inhalation anthrax, which causes severe respiratory symptoms. Tinea, also known as ringworm, is a fungal skin disease affecting different areas of the body. Tinea capitis is found on the scalps of children. Tinea pedis, also known as athlete's foot, is found between the toes and on the feet. And Tinea cruris, also known as jock itch, is found in the genital area. Dermatomycosis, also known as Tinea versicolor, is a fungal infection that causes white to light brown areas on the skin. An infestation is the dwelling of a parasite on external surface tissue. Some parasites live temporarily on the skin, others lay eggs and reproduce there. Scabies is a skin infection caused by an infestation with the itch mite. Pediculosis is an infestation with lice. There are 3 types of lice, each attracted to a specific part of the body. Pediculosis capitis is an infestation with head lice. Pediculosis corporeus is an infestation with body lice. Pediculosis pubis is an infestation with lice in the pubic hair and pubic region. A callus is a thickening part of the skin on the hands or feet caused by repeated rubbing. A clavus, or corn, is a callus in the keratin layer of the skin covering the joints of the toes. A cicatrix is a normal scar resulting from the healing of a wound. Granulation tissue normally forms during the healing of a wound to create what will become scar tissue. Granuloma is a general term used to describe small, knot-like swellings of granulation tissue. Granulomas may result from inflammation, injury, or infection. A keloid is an abnormally raised or thickened scar that is usually smooth and shiny. A keratosis is any small growth, such as a wart or a callus, in which there is overgrowth and thickening of the skin. A lipoma is a benign fatty deposit under the skin that causes a bump. A papilloma is a benign epithelial tumor that projects from the surrounding surface. Polyp is a general term used most commonly to describe a mushroom-like growth from the surface of a mucous membrane, such as a polyp in the nose. These growths have many causes and are not necessarily malignant. Rhinophigma, also known as bulbous nose, is hyperplasia of the tissues of the nose. This condition is often associated with rosacea. Skin tags are small, flesh-colored or light brown growths that hang from the body by fine stalks. Skin tags are benign and tend to enlarge with age. Fortunately, most skin cancers are curable. Sun exposure is one of the main factors in predicting skin cancer. An actinic keratosis is a precancerous skin lesion caused by excessive exposure to the sun. Actinic keratoses are raised, rough, dry, or scaly spots that are tan, brown, gray, or red. Basal cell carcinoma is a malignant tumor of the basal cell layer of the epidermis. Found mainly on the face, this is the most frequent and least harmful type of skin cancer. Basal cell carcinoma is slow-growing and rarely spreads to other parts of the body. These lesions are smooth and raised and have a depression in the center. They are pink and tend to bleed easily. An epithelioma is a benign or malignant tumor originating in the epidermis that may occur on the skin or mucous membranes. Malignant melanoma is skin cancer derived from cells capable of forming melanin. This cancer can occur in the skin of any part of the body and may metastasize to the lungs, liver, and brain. These lesions are usually asymmetrical, have irregular borders, have mixed colors, and are larger in diameter than a pencil eraser. Moles with these characteristics may be signs of malignant melanoma. Squamous cell carcinoma begins as a malignant tumor of the squamous cells of the epithelium, but it can quickly spread to other body systems. These cancers start as skin lesions and appear to be sores that will not heal or sores with crusted, heaped up look. A burn is an injury to body tissues caused by heat, flame, electricity, sun, chemicals, or radiation. The severity of a burn is described according to the percentage of the total body skin surface affected. More than 15% is considered serious. It is also described according to the depth or layers of skin involved. A biopsy is the removal of a small piece of living tissue for examination to confirm or establish a diagnosis. In an incisional biopsy, a piece but not all of the tumor or lesion is removed. Incision means to cut into. In an excisional biopsy, the entire tumor or lesion and a margin of surrounding tissue are removed. Excision means the complete removal of a lesion or organ. In a needle biopsy, a hollow needle is used to remove a core of tissue for examination. Exfoliative cytology is a biopsy technique in which cells are scraped from the tissue and examined under a microscope. The skin is able to absorb certain drugs and other chemical substances used to treat problems ranging from acne to angina attacks. A topical application is one that applies to a specific location. Topical medication is put on the skin to treat the area that it's applied to. Transdermal refers to application of medication to unbroken skin so that it's absorbed continuously to produce a systemic effect. A transdermal patch may be used to convey medications, such as nitroglycerin for angina pectoris, hormones for hormone replacement therapy, or scopolamine for motion sickness. Sunscreen that blocks out harmful ultraviolet B rays is sometimes measured in terms of the strength of the sun protection factor. Some sunscreens also give protection against ultraviolet A. Cauterization is the destruction of tissue by burning for therapeutic purposes. This technique is used in conjunction with curettage to remove and destroy basal cell tumors. Curettage is the removal of material from the surface by scraping. Chemical peel, also known as Chemabrasion, is the use of chemicals to remove the outer layers of skin to treat acne scarring, fine wrinkling, and general keratosis. Cryosurgery is the destruction or elimination of abnormal tissue cells, such as warts or tumors, through the application of extreme cold, often by using liquid nitrogen. Debridement is the removal of dirt, foreign objects, damaged tissue, and cellular debris from a wound to prevent infection and promote healing. Dermabrasion is a form of abrasion involving the use of revolving wire brushes or sandpaper. Incision and drainage (IND) involves incision of a lesion, such as an abscess, and draining the contents. Mohs chemosurgery is the use of zinc chloride paste to remove recurrent tumors and scar-like basal cell carcinomas with a minimum of normal tissue loss but complete removal of the tumor. As each layer is removed, it is examined microscopically, and the procedure continues until it is determined that the entire tumor has been removed. This technique is especially useful in treating basal cell epitheliomas. The term laser is an acronym for light amplification by stimulated emission of radiation. An acronym is a word formed from the initial letter or letters of the major parts of a compound term. Lasers are used to treat skin and many conditions affecting other body conditions. Each type of laser derives its name from the substance within the laser tube. This substance is stimulated to emit light that is strengthened to a specific wavelength. The wavelength and power of the beam are the keys to the laser's effect on the tissue. Some wavelengths are capable of destroying all skin tissue. Others target tissue of a particular color. Rhinophyma is treated by using a carbon dioxide laser to reshape the nose by vaporizing the excess tissue. Port wine stain is treated using short pulses of laser light to remove the birthmark. Treatment may require many sessions because only a small section is treated at a time. Tattoos are removed by using lasers that target particular colors. Lasers are also used in the treatment of some skin cancers, precancer of the lip, and warts that recur around nails and on the soles of feet. Blepharoplasty, also known as a lid lift, is the surgical reduction of the upper and lower eyelids. Dermatoplasty, also known as a skin graft, is the replacement of damaged skin with tissue taken from a donor site on the patient's body. Lipectomy is the surgical removal of fat beneath the skin. Liposuction is the surgical removal of fat beneath the skin with the aid of suction. It is also known as suction-assisted lipectomy. Rhytidectomy, also known as a facelift, is the surgical removal of excess skin for the elimination of wrinkles. Sclerotherapy, used in the treatment of spider veins, involves injecting a sclerosing solution into the vein being treated. This solution irritates the tissue, causing swelling, and eventually closes off the vein. Hey, while you're here and before you go, check out these awesome career opportunities associated with the skin and the integumentary system. We've got esthetician, also spelled esthetician. We have paramedical esthetician, dermatology nurse certified, and a burn care nurse. Also, make sure you check out the health occupation profile on dermatologist. If this conversation produced some questions, make sure you ask next time we talk. Well, thank you so much for learning about the skin and the integumentary system today, and make sure that when you go outside, you use plenty of sunscreen. Have a wonderful day, be good people, do good things, and we'll see you next time. Bye-bye.